So here eh? Ha ha ha.
Solomon Island consists of over 1,000 islands. 80% of the population of the stay low rural areas. Access low health services hemi low to increase low lifestyle diseases, non-communicable diseases, while communicable diseases hemi still continue. NCD's data of Solomon, over 69% deaths are caused by NCDs such as cardiovascular disease, cancer, chronic respiratory disease, and diabetes in 2018. Prevalence of diabetes have 14.3%, raised blood pressure have 19.6 among 18 to 69 age group. NCD's admission low natural hospital silver hem 84% and death hem 87%. Foot amputation surgical ward was 3 to 5 amputees per week. CD data Los Solomon prevalence of malaria 40% among all age groups, low risk areas in 2016. NCD and malaria are not national priority.
If the non-communicable disease make up a high proportion of admissions in the hospital, especially the medical department, medical ward. 60% of those people who are admitted are non-communicable disease. Out of that, majority are diabetes. It affects the hospital in terms of occupying the number of beds, and non-communicable disease attributes like 88% of the bed occupancy rate here. The non-communicable disease also leads to longer stays, so they stay at least 11 days, so it's having a burden on the hospital resources. So we keep a lot more non-communicable patients than the infectious patients.
Keys for reducing health issues, more disease prevention and health promotion. 1995 Fanuka Healthy Islands Vision 2016-2020 Solomon Island National Health Strategy Plan 2016 Ministry of Health and Medical Services and JICAP starting this for HPV with an aim object for developing a model addressing multi-health issues low village level. Main implementers below healthy promoting village project Nahemi national and provincial health promotion departments. Oketa work closely with them NCDs, nutrition, water and sanitation, malaria and nursing departments inside the Ministry of Health and Medical Services. Project is selecting total of 15 villages from Guadalcanal and Makira, Ulava province.
Healthy village approach is an approach which enabling people or empowering people to take control of their own health and also addressing the health needs in the villages. This approach is promoting changing of behaviors, especially healthy practices and healthy lifestyles, and also changing of environment. It is an approach where call for integration and also a call for support from different stakeholders to address the identified health needs of the villages. This includes the non-communicable diseases, communicable diseases, injuries, and other health issues were happening in the villages. So like when we're talking about the communicable disease, we're talking about malaria, we're talking about influenza, and when we're talking about NCD, we're talking about the hypertension, diabetics. It also addresses the nutritional status of the villages, So we are talking about proper dieting for general populations. It also addresses the personal hygienes in the villages and basically cleaning up the villages. So it addresses different many health issues in the village.
Mi fala mi wetem okata group lo mi fala cleaning around now whole community lo area lo mi fala no. Kain mi fala living osem one day for mi fala wakano. Mi fala usually take him now every Friday.
Diki mapa dry pit whole pit potroem rubbish and sell coconut, tin and something also. And another activity mommy fala usually do like every morning people have to walk 1 hour before I go to garden.
Some fala change where me looking inside the program na people got to work together about team village blue fala lo side lo cleaning place and yeah people work together.
Talem about team NCD or Sikia and Otayana osem what something where me come from what talem people for me follow home na Otaya. People otabara interest na for doing more things what me talem what interest na for come and doing what me talem people come.
Meeting him two main resources important for Solomon Islands. One is human resource and material resource. Human resource important because human being now doing things and making things happen. Yeah? Therefore, human resource must capable or must train him good, lo different field of specialty, so that me need him inside lo field, lo side lo sabe, by sabe system community. And material resource, second something important for Solomon Islanders is when you need for improve or doing things inside the place, you need him material resource like say transport, you need him engine, OBM. How do we promote that? Change through this track project. One is because Okata must live by example. Live follow what Okata teach or telling people. Make it two according to experience inside what you do inside the place, and make it third is what the finding what the current after evaluation or what the look back long how far now what perform or doing work inside the community block, and also by way of gathering people or putting people together and or sharing ideas for side improvement or similar or things or like doing inside the places block.
Right time jaga hem come who look below me inside the villages. Okata people okata happy, okata healthy, okata osim na inside the village. Beginning and me like good something. No in Siki, Taka, I'm not right now. Me look inside the family bloom, ocean live bloom, hemming good inside the family bloom. Ocean, Kai hem good, live hem good, everything inside the family hem good. Side bloom is live inside the family bloom.
Okay, last time people ought not have a communicate, yeah. People ought to chief on ought to leader of community ought to try to talk, ought to have hearing something. Okay, time if I join workshop, then if I come back, if I look if I tell them what things if I go hearing lot there, ought people ought to also ought to change a little bit, ought to hearing something time if I tell them.
Health in any country is a complex organization, and in Solomon Islands, the Ministry of Health and Medical Services is the government agency which oversees health and implementation of health activities across the country. With strength, currently, as what I can see, is that the leadership in the ministry is very strong, and the ministry has strategic plans in which divisions align their corporate plans and deliver services according to the various strategies that are being developed. And so that, to me, that is a strength. Health in the Solomon Islands, also one of the strengths that I can see is the partnership that it has with development partners, and like the UN agencies and the diplomatic corps. And so, for example, with the Japanese embassy, we have the Japanese International Cooperation Agency, which supports the ministry in various areas, including healthy setting and including implementing the annual operational plans of some divisions of the Ministry of Health. In terms of weaknesses, the ministry is faced with a lot of human resource issues. With a ministry that has so many divisions and specialized services, it demands a strong and vibrant human resource management, and so human resources is one. I think the other weakness that the ministry has is in the distribution of resources to all the provinces. We have the National Referral Hospital as the main curative body in here in the country, but we also have provincial hospitals that run similar services, and perhaps maybe in the distribution of equipment and human resources and other important resources. That is, to me, is a challenge that the ministry will have to address as it concentrates on delivering services that is distributed equally to the people across the nation. There are other issues that challenges the operation, such as geography and ethnicity and those kind of things. And these are things that the ministry just have to find ways to work along, because there are certain things that we cannot really address, but we have to look at innovatively look at ways in which we can address many of the challenges that has contributed to the difficulties and the weaknesses of how services are delivered across the country. First of all, as a member of the Ministry of Health Executive and the head of the nursing division, I must acknowledge the government and the people of Japan for the continuous support to Solomon Islands people. Through the JICA project, it is one of many projects that has been implemented under the Japanese International Cooperation Agency, and the Healthy Village Promoting Project is one of successful engagements by JICA in assisting the people of Solomon Islands. I see the JICA project has been successful in addressing community health issues, and that is a very critical area to me, and strategically community health activities and implementation of community health activities are very important, because it is where a majority of the population actually lives. And I see that this project, even if it has come to its end, the ministry needs to take up the challenge of sustaining the activities that were introduced and the work that has been started. It is strategically it is a way forward, a very important way forward that the ministry takes on the activities that were introduced in the project. So I think that is how, although we have experienced some challenges in terms of administering the project, but overall I can say that the project has been a success in terms of addressing community health services in the country.